You're live again.
Okay. All right. Hopefully that was interesting and informative for everyone. We appreciate those folks coming. The next item on the agenda is approval of minutes and expenditures. So we have approval of January 26th meeting minutes. James was not here. Tim, I believe, came in late, yeah, right? Was that the date, Tim?
No, I don't think Tim is.
Okay, but Amber and I and
Yes, Tim
Ms.
was.
Davis can at least vote on that.
Make the motion accepting this.
Okay, so the motion, in a second,
Yes.
okay, on discussion on those minutes. Everyone got a copy. So all in favor of approving the minutes as written, please say aye.
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 Thank you. Next is approval of the February 23rd meeting minutes. Dr. Henry was not here. Have a motion. To approve those minutes for the February 23rd, 23 meeting. Second. Okay. Everyone got a copy of those minutes? Any discussion on that? Hearing none, all in favor of approving the minutes as written, please say aye. Aye.
I abstain.
Opposed? Aye. Thank you. Those approved. Next item is approval of February 2023 expenditures. The amount I have for those is $245,194.86. Motion to approve.
Second.
Okay, so motion and second to approve those. Any discussion?
Mr. Chairman,
Pam?
I'm noticing on February the 7th, Law Chronic Consulting, and I know that Ms. Homer decided she wanted this consulting, strategic planning, as well as the board to approve it. And again, on record, I want to state that I believe that this is something Ms. Homer should do for us as a salaried employee, as a director, instead of us having to hire another person. And then the next thing I want to mention, I see that on February 23rd, invoices paid to Architect Now again for Aspen development, continuing to be developed. Nothing going on yet with Aspen. Is that true? Nothing going on. Actually working, people using it.
We have a report.
You're gonna give that report, okay. So what I understand, program development, what it says here, 23,787.50, another invoice for 35,312. That added up to $59,000. That brings us to a grand total of about $760,000 since last June for the public that's following it. And that's all I have to say for now.
You have a point there? I'm not.
Just talking about it. People are asking a lot of questions.
What kind of question? You're not answering any question.
Well, I'm stating, they're asking how much we're spending on it per month, and so I point that out.
Any other discussion on that?
No,
I was scared, to point out that we spent almost $9,000 on the micro trailer for preparedness to be a closed trailer for preparedness. Thank you for that.
Okay, any other discussion? Hearing none, everyone in favor of approving expenditures? Please say aye.
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 and I oppose. It's being spent in Alaska.
They ask you why?
Personal,
First,
for some reason.
That is on grant.
your board member, Davis.
I can't, I can't vote yes or no. You have to direct that for me,
I mean, that's gonna be why you're voting no.
and I told you why.
No, you didn't.
Well, okay, since you mentioned it, when we were told about Aspen, I wasn't told that it was gonna cost this much. That, I was never mentioned the costs of it, it was just about the program and what, what type of stuff it was going to do. That it was gonna help people, that were suicidal, troubled youth, whatever. I thought that would be wonderful. But then I believe that now that I'm seeing it, it's costing a huge amount of money, and the money's not going directly to the people that are suicidal, people that are troubled. It's going into a program,
You're saying we're not paying people? for
Right.
Suicidal?
right? We're not,
We're not supposed, you want us to pay people who are suicidal?
I want them to be able to go to a counselor that's not bottlenecked. I want them to get in to be able to see them, and it's free for it.
Okay, we have a report coming up, so you're spreading a lot of misinformation. on
I
this.
wish you would use that word when you
What?
talk about me.
I could use another word, but,
You asked me, and
What's
so
the-
I shouldn't have asked. I told you the truth.
no,
I'm concerned about the cost. It was not told us prior.
well, and that falls in and of itself.
Did you know it was gonna cost over $705,000 since last June?
Yeah.
You did?
But that's not the total amount, this is an ongoing.
It's still going, yeah.
Sure.
They're not done developing it.
Do you understand what these costs? What it costs to do this program?
Yep, that's why
You
I'm
do?
really,
Can you tell me,
Really?
what do you think is a reasonable amount?
well, I think if I had $760,000, I would give it to Country, and I would help them hire more counselors to see people that are bottlenecked. It might take a month for somebody to get an appointment to, for their child that's having a problem, or for whatever reason.
Being countries involved.
It would be nice. It would be nice for them to have those same
You
funds.
understand that they're involved in this, correct?
I understand they're involved, but they're not getting the money directly to help people. This is just a program in a computer that's being developed.
No.
Mr. Teal,
Yeah.
I'm sorry. Please.
So next is approval of the, February 2023 electronic payments. Actual amount of those was $497,854.16.
Make a motion, we approve.
Second,
Okay, so motion and second to approve that amount for electronic payments, so any discussion?
Mr. Chairman? I'm noticing that, kind of added it up before I came. I noticed, Missouri Employees Mutual, Laggers, payroll taxes and liabilities, and such, and United Healthcare. So I added those up. That was 183,000. This is in regards to our employees. This is their taxes, payroll taxes, insurance, and healthcare. And then I added up, and then it shows on this month that we paid $267,000 in salary, employees' wages, etc. I looked at that in comparison to from 183,000 on taxes, insurances, etc., and looking at the actual salaries that we're paying out, 267,000. And I just thought it's quite seemed odd. And so I did a little bit of research really quickly. I could stand to be corrected on it, but approximately 38% is kind of normal to spend on your employees for their health care, payroll taxes, etc. And that would be only 101,000. So we're spending 180, we'll probably double that. Maybe we ought to look into it possibly.
I'd like to make a motion to dismiss 10% of the staff to make her happy.
What was that, James?
I'd like to make a motion to dismiss 10% of the staff to make Susie happy.
No, that's not what I'm saying, James. That was a pretty smart remark.
No, you're, so.
No, I just.
Betty, please, can I clarify something from you?
Sure, absolutely.
On United Healthcare, when you're looking at that total,
Mhm.
that also includes dependent care that some employees are paying for out of their paycheck each month. So you cannot look at that total and say that that's what employees were paying for employee health care.
Oh,
And
okay,
we have to pay for workers' comp insurance and we have to pay for payroll
sure, we, absolutely,
In retirement.
and retirement.
absolutely, yeah. But I just would like to look into it. I think that's-
It's looked at every
Every
year.
year you do that before you make accusations.
That's not an accusation,
You made an accusation.
that's not an accusation.
You're insinuating fraud, is what you're insinuating. They're paying too much more.
It's said that, I said that.
All I'm saying is you could.
183,000 in expenses for payroll and employees
Okay, any other?
seemed high that we
any other-
might look into to see where we can maybe get companies that would charge us less for healthcare, et cetera, et cetera.
Do that
Do that.
constantly.
That's what I'll
Every year.
clarify that for you.
Well, we do that constantly. I'll clarify that for you.
Well, I've been here 3 years and I haven't seen a committee that goes over all those things.
Well, then you missed out because we have those.
I think Ms. Davis is on it.
I'd like to see the minutes of that, what we've looked over and the different companies and what they're offering
It's fine.
in comparison to each other.
Okay, so all in favor of approving those electronic payments, please say aye. Aye. Reading vote,
No,
thank you.
You're not voting or you're opposed?
I vote.
Last pre-approval is for the April electronic payments, and the estimated amount of those is $588,112.25.
I make the motion to approve.
Second.
Discussion on those. All in favor of approving the electronic payments, please say aye.
Aye.
Say no on that one.
Okay, so let's see here. I can do the clinical services report first, correct? Melissa?
Hi. How is everyone today?
Good.
Just a couple highlights from the clinical services report. And I want to spend a little bit of time talking about dental and some of the graphs and charts that you have in front of you for our dental program. So a couple of highlights. I mentioned last month that our family planning program received some supplemental funding for a special project. A period poverty project where they're putting together kits to supply to individuals who have difficulty buying those products at this time. We're using those within our clinic areas, but we've also just recently started partnering with some of the school systems in Jefferson County, and we're going to be working with those systems as well for this program. In our general clinic, we've done a couple of things in the last month to work towards quality improvement on some of our processes. We had a state coordinator for the VFC program come down and spend some time with us, and we're working with the state to look at our procedures and processes for vaccines.
VFC's vaccines for children.
Correct, that is a federal program.
Thanks.
Thank you. And we're looking at things like appointment reminders for appointments. We're looking at things like a recall system if folks don't show up for their appointments. We're looking at our vaccine rates within the county. And we're working with the state to look to see what can we do to make improvements on that program. Our TV coordinator continues to work on pulling TV services directly into our clinic. So there's been a lot of work done to build things in our QRMD system and to be about policies and practices and procedures to meet all of the state guidelines. We're also working on our wellness lab program to make those labs directly available to patients on the web portal through QRMD. We've done a lot of work over the last month to make those labs directly accessible to patients. So that if they do have a portal and they have wellness labs done, they log in, those labs are right there for them to see and view. And then I want to talk a little bit about dental. So last month, I showed you guys a dashboard for medical. and received a little bit of feedback, so thank you, Mr. Prager, for providing some feedback on that. Was hoping to be able to make some adjustments to that dashboard, and we had a software upgrade this past month. And we're starting from scratch on that dashboard. So, getting started on it again, but you may not see that for a little bit, so I just wanted to explain why you may not see that for a little bit. Okay, it may take a couple more months for me to rebuild that.
I have a question.
Yeah.
Who is it that's in charge of our, what people hear when they call our department? The phone, you know, when they're waiting on hold while who's in charge of that?
Ms. Davis, that has nothing to do with the presentation.
Well,
You can
James,
add
she just said that James talked to her about something and they made a change on.
on the clinical services report, ma'am.
Yeah.
Yeah, last month I asked for
I'm just
feedback,
wondering.
and he was kind enough to provide feedback on that medical dashboard.
So is there gonna be an appropriate time when I can ask that question?
You wanna know who answers the phones?
It's just what's being said when you're sitting on hold. In regards to what you're hearing while you're sitting there. You know, instead of getting right to the
Mr.
point.
Dix, I ask that our presenter be given the opportunity to finish the report.
But I just need to know when we can talk about that. Can we talk about it before we close the meeting today? Okay.
So I refocused the dashboard on dental. Our dental electronic medical record system doesn't have a readily available dashboard. So I did a little bit of the old fashioned Excel spreadsheet type of dashboard. So that's a little bit of what you're seeing here. I do want to let you know that we are continuing to add clients and patients for our dental services. In fact, we just picked up 2 schools in the past few months. So that program is very busy and having a lot of applicants for that dental program. What you see on the dashboard is just a couple of different views that I thought might be useful to see. One, where we're at with some of those dental services, but then also a little bit of a progression of where we came from with the dental program and where we're at now. So the first chart shows our current dental active patients by age. And some of you may be aware that when we first started our dental program back in 2005, we were focused on pediatrics. It was a kids program, school-based, and we still have that program, and it's a fantastic program. But over the years, we have expanded those services. And in 2016, we added the senior band program for dental services. And since then, have just continued to add on based on need. So the chart you see here shows that even though we're still seeing a ton of kids, young age, and we're still seeing 65 and older, it's starting to grow within, in between that as well, in the ages of 35 to 44, 45 to 54, and 55 to 60. There is definitely a shortage of dental providers in the area that will accept individuals with Medicaid. And that we continue to have a high demand for those services. The next chart,
No, I'm sorry, I thought the numbers looked really good for dental. And do you know, or does anyone know if Country's providing any services?
they are still providing dental services.
Good.
Yeah.
Cause I think they stopped for a while, didn't they?
I think they had a turnover in dentists at one point. They may have had a little bit of a hiatus, but
Right.
I believe they're still providing services. I want to remind everyone that we have one dentist. We have one dentist, 2 hygienists, and 1 dental assistant. And that team works between vans all over the county and is providing services directly in the county so that kids don't have to take off a day of school to go get dental services. Parents don't have to take a day off work so that their kids can get dental services. So the team has done an amazing job of trying to balance all of it. So the next chart just kind of shows that we are continually adding new patients. And it kind of goes up and down a little bit, and that's based on when we get those applications, moving between schools, you know, putting out the application for a school system for parents to sign up. But this chart over the last 8 weeks, I apologize, just shows that we continually grow and see new patients. It's not necessarily the same patients over and over, even though we do have a lot of repeat patients as well. The next chart shows you our production by procedure category. And I thought you might be interested in this to see just the wide range of services that we're able to provide through our dental programs. So we're not only doing preventative care, cleanings, fluoride sealants, we're doing diagnostics, x-rays, exams, we're doing restorative services, fillings, extractions, crowns, bridges, dentures. So this just kind of gives you that view of across the board, the type of services that we're able to provide. And then the last chart just shows you a little bit more about the numbers of procedures that we perform month to month. And it goes between the adult procedures and the kids. So you'll notice during June, July, August, there's not a lot of volume there with the kids because the kids are out of school, but then it picks up with the adults at that point. So the number of services across the board that you can see here that are provided month to month is just consistent as we move forward. Questions about any of that?
Reports are busy,
Yeah.
very busy. Well, but
Thank you. Thank you.
thanks.
Thank you. Okay.
If Jackie's asking for it, and then you're also gonna do the application approval, right?
Yes.
So,
If we just skip over the financial, we're coming back to that. You said in the director's report.
Right, I'm sorry, what are you asking for?
In our packet, there's financials. With our investments.
Oh, it's not on the agenda.
If they are- That can be in Kelly's report.
The status that wasn't on the agenda, that's provided for your information as a board member.
All right, so thank you for having me again. I understand there has been a lot of questions and information, and I believe some misinformation circulating regarding Aspen, such as its history, funding, security, and I'm going to try to respond to some of those questions today. And just so you know, as questions come in, I am working with administration, with our PIO to address those questions. And we are also working on trying to get a video together with some of the developers so that they can respond on video to some of the security questions, as well as some of our consultants that are either individuals from schools or licensed providers to help get information out there in a way that's easily accessible to the community. So I just want to state that as well. So the first question that I want to address is the history. I know that that has been a common question. I do want to say that my name's Jacqueline. And I am one of the faces behind Aspen, just accessing services, providing essential needs. And prior to 2018, I was an associate director with the Head Start program prior to working here. And I was working directly with families while trying to connect them to needed resources. At one point in my life, I was a single parent utilizing Head Start services, often utilizing services such as we have here for myself and my child, and trying to navigate needed services or lack of resources that we may have had within the community. That drove and empowered me to continue going back to school, and eventually move into an administration role with Head Start, where I worked to help other families in our communities. In 2018, a new position formed at Jefferson County Health Department, and it was to be the facilitator and coordinator of the newly formed Jefferson County Health Network, which was designed to address lack of access to care, resources and referrals, and other rising needs in our community. JCHD continues every day to address these rising needs in our community. And in 2018, when I received that position and started that journey, we had a vision as a network of 40 providers, partners, individuals, and community members that we could utilize technology to develop an exceptional resource directory to better help families link to needed care more easily. I was blessed to receive this position and begin that journey that has now been the development and solely the implementation of what is now known as Aspen, accessing services, providing essential needs. I, JCHD, and many partners, providers, school representatives, community members have been working for years to identify needs in our community and developing this multi-layered virtual system. Aspen provides a directory for users to identify and utilize key foundational public health and community services. And key foundational services within the Jefferson County Health Department fall under the Missouri Foundation for Public Health Fundamental Services and Capabilities that state by law must be made available in every community. To ensure the foundation of Missouri Public Health System, Aspen does help in some of these areas, including linkages to medical, behavioral, and community resources, injury prevention, such as including mental health and substance use. And it also states in the Missouri Foundational for Public Health Fundamental Services that these must be made available to the public, as well as providing timely, accurate, and locally relevant information on consequences for adverse childhood experiences, otherwise known as ACEs. For those that don't know, that is a type of screening tool that helps identify early needs that an individual may have due to childhood experiences. These can be found on the healthiermode.org website. Other questions have been regarding data. So Jefferson County Health Department and partners from 2015 and 2018 collected data from partner surveys that identified needs for access to care and resources and referrals in the community. And as noted previously, JCHD is a public health center in the state of Missouri, and within the Missouri Foundation for Public Health Services model, priorities include the following capabilities that align with Aspen's goals and objectives. These capabilities are noted on each of the monthly Aspen board reports that you guys see, highlighting how objectives align with these capabilities, including linkage to medical, behavioral, and community resources, injury prevention, community partnership development, health equity and social determinants of health, assessment and surveillance, and local responsive programs and services. In 2018, Jefferson County saw an increase in youth suicides and overall rising needs for mental health services. This began the point where we went from just looking at a resource directory to what we could do as a community, working together with the health department leading that charge to help addressing mental health. Data continues to show that access to care and linkages to resources, especially among substance use treatment and mental health services, are a high need in our community. The Aspen Frequently Asked Questions document includes links to updated mental health, including the 2020 medical examiner report, where it stated 3 individuals under the age of 15 had completed suicide in 2020. 1 was under the age of 12. 2020 also identified that the medical examiner report also stated total deaths by suicide in Jefferson County that year were 53. And of these, 13 were between the ages of 20 to 29.
Jacqueline,
Yes,
can I ask you a question? So is Aspen funding these people to go get counseling, these troubled families when they're having?
Aspen itself is not funding. Aspen is the tool that helps identify if there's risk. Aspen also houses now, as of this past week, over 940 resources. So an individual or a school counselor or partner could go in and easily navigate those resources. I do want to point out, since you're bringing that up, that's a really good question. Under the local public health disparities initiative, DHSS grant, yes, a portion of it does help provide support for Aspen. That entire grant is $908,215 that we were awarded as an agency. I do want to note that one of the contracted services in that grant is to support a licensed counselor to meet individuals within our community that have needs regarding mental health. And they are working with some low-income individuals and some individuals that are homeless.
So we do have a counselor that we hired.
We don't have one on staff. We are contracting with one of our partners and utilizing some of the funding to support a counselor through Chestnut.
So it's not directly going to the kids that are needy.
They provide those services either free of charge or with a sliding fee to support individuals, but we do partner with Comtree. Comtree is one of the funding streams that help design Aspen. Comtree has been on the forefront since day one in our meetings in 2018 when I was hired. They see Aspen, Providence sees Aspen as a tool. Chestnut, another one of our counseling and substance use resources, all of the partners, Mercy, Jefferson, we all came together and decided that we needed a better way to identify children, to identify first responders, to identify
Children.
Mr. Chairman, may I please ask that Mr. Chairman, may I please ask that Jacqueline be allowed to finish her presentation? And I believe that Ms. Davis's questions will be answered. But I would like to reiterate that Aspen is a tool, as she just mentioned, that was needed
For resources.
to be able, Ms. Davis, it is a tool that you said was needed to be able to put people in to the appropriate level at the correct line of the system. And so when you're talking about bundling them into the correct spots, instead of everybody going into the same spot for treatment and overloading the mental health system, Aspen has been a unique tool in that it has been one of the first programs that has brought together all of the independent private mental health providers within our county around a tool and issue to be able to help the community residents. I would really appreciate if you would allow her to finish her presentation and she would welcome any questions that you have.
Right, but Kelly, you're talking like if this is going on now and then doing that, like, you say it's doing this, but it's not, it's still being developed, is that correct?
Ms. Davis, if you would listen to the presentation and read the reports that have been presented to you on a monthly basis, you would understand the answer to that question.
So I'm super happy to answer that. So yes, I do want to go back to what I was stating to make sure that people get that entire statement. Use my words correctly. So yes, it has helped to identify if a child is at risk. So it is utilized to give the school counselors, the parents, and social workers, if they are included, the ability to work with the parents then to see if the child is at risk for either substance use, mental health, or violence ideation, that they can then connect the parent to the right resources. And I'm super excited. Like I said, there's over 940 resources in there as of today. We attempt to vet those resources. Majority of them are mental health. So we also recognize someone like my child may not do well just sitting in a room with a counselor. So they may need equine therapy where they can go out and work with horses and a therapist. So we identify those resources in the community because that might be better for that family and that child to get the help that they need. Also play therapy, music and art therapy. So we look at all resources to help give the parents and the child choice for what might be the best resource for them when they have a need.
So Jackie, when you identify the resources, you also give them a voucher to go to that resource to obtain that.
Not at this time, but that's what the tool is able to identify if that particular resource takes their insurance. If they don't take their insurance, it also helps filter down to if there is if there are counselors and therapists that work with clients at a sliding fee or don't take insurance. For example, the Provident counselor that we have partnered with that has utilized our space will be able to see most children in the community free of charge due to additional grant funding. And also That's why we work so closely with some of the other counselors to help also support them and make sure that they have the data to then they help them get grant funding so that they can get extra resources to help fund support for services such as free of charge for families that need it. So I know security questions have been asked. So I've addressed this previously, but I do want to state again that Aspen is cloud-based. It is a computing platform that allows businesses to run applications and store their data securely in the cloud. It provides tools and services that helps businesses develop, deploy, and manage their applications easily. And Azure complies with various global security and privacy standards and implement security practices such as encryption, threat detection, and access controls. We also work with the developers where while we are in different development phases, they do a lot of what they call security audits, where they have other individuals. They don't look at any de-identified data, but they work through the coding and some of the ways that the system works to make sure that there's no security concerns and issues. And again, I don't have an IT background, so I can't explain the details, but we do make sure that they take those additional security measures. Yes, sir.
Yeah. It may have been covered before, but
That's okay.
it's Aspen used where else?
Aspen itself. Aspen,
This is development program?
we have developed it. So
I didn't know that.
it is not something, we didn't purchase it. We developed it from the ground, the cloud up, the ground up.
You are actually making.
We have,
Building this airplane.
we have built it. We are building the airplane as we are flying. So as we,
You guys are-
we are in the forefront.
And you are making something that everybody else in the country will be using.
That's my dream.
I can see it happening.
I can tell you we've been approached. I'm gonna answer Mr. Big's question. I'll take it. We have been approached by other counties and other children's funds throughout the state. We've been approached by the state fire marshal. We've been approached by the Department of Elementary and Secondary Education, the Missouri Department of Mental Health, and other entities that are very interested in Aspen. And that is also why we had continued through this process to write for additional grant funding, had received grant funding from ComSpan Department of Mental Health. Because not only do they believe in it, they want to help fund different things. Because again, as we started, we wanted a resource directory, then we saw a need for mental health. So as we continue to work, we decide that we need some additional layers in, as well as we like to roll out very slowly. So it is currently being utilized. We did not want to just make this open and a free for all. We wanted to work in pilot phases. So our first pilot phases were with schools. And then we took a lot of time to get feedback. We spend a lot of time going in and working with the school counselors, making sure that the systems work, making sure that everything is appropriate. We're working with schools now to try to engage with parents. That way they can ask as many questions as they want. So we're working with them for opportunities, either for parent events, a few minutes before the band concert, having a table at an open house where parents can come and ask us questions, and we can also present and share the information with them. We also work with the school counselors and social workers so that students are aware what it is. So that way, if their parent has signed an agreement and they do choose to use one of the screening tools, that they are then aware of what it is and why it might be important to them. So yes, currently, as you can see in your report, it is being utilized. In schools, again, we did not want to just open the floodgates. We wanted time to be able to go back, and when we get feedback of, hey, we would actually like this button here, or this question could be worded differently, or this workflow that we thought was brilliant when we were developing the plane and flying it, we're realizing actually we need it to go this way. We also continue to add in security measures, so that is why there is continuing development, yet it is still being utilized. So the students, you can see some of the metrics there. We had 45 assessments or screenings completed. And of those, 4 were medium risk and 2 were high risk. So we do try to provide that data. So again, out of the 8 schools in Jefferson County that are utilizing it, It is small numbers, but again, that's because they didn't want to just open the floodgates. They wanted to make sure that parents were informed, students were informed, and we're slowly starting to use it. And some of the students that they began using it with were some of their higher risk students that they were already working with the families. And families are very involved in this process because families have to be involved when they get them enrolled in state counseling. They have to make those choices. So they work with those parents. I'm sorry. Yes,
So, so I had a parent get a hold of me this week, and she was in tears. And she said, her son had been bullied, for quite a while, and, just one day he just had enough, he couldn't take it anymore. Something his uncle told him, you know, you need to stand up to a bully, and leave you alone, just stand up to him. So he did, and he was, here comes the teacher, and, he, there was a little altercation between the two, and, teacher came along, and of course he was in trouble, as well as the bully, and, long story made short, the child is now in the system, and he's considered a troubled youth. And, she said she can't get them to give her any information. And he's a good kid, she says,
Can't say who to give them.
the mother can't get information from whoever has that file.
So we don't have files, so we follow, this is just the tool. So this does not alter or change what a school policy and procedure is. It is simply a tool that if the parents give permission, the students have access to the self-screening option. The resource directory is live, so that is public. Anyone can go on at any point in time and use that. But Aspen is not, and I'm so sorry that happened because it is bullying, we do hear that frequently, that is an issue with a lot of mental health issues. But in this case, Aspen does not house the child's record. It is not a student information system. So that would be the school's policy and procedure, which with however they handle bullying. And that's where she would have to work with the school on that information. Aspen does not alter or change or adjust any of the school policies and procedures.
So let's say your son signed up for Aspen before this, still should, I don't know if he did or not, he probably didn't. But, would she be able to get a copy of what he's been journaling into that?
It's
program?
not a journal, but if he had completed a screening tool, which does have the questions, they could talk with the school and get that information. There is some information that may be counselor client privilege, and that's where they would have to work with the school policies and procedures, but that's where the Aspen is not it's not part of the school process, it's not part of the student information system, and it doesn't house the child's mental health records and things like that. It is simply a screening tool that then connects the student to the school counselor, so the school counselor can then work with the child and the parent to identify if there is a risk, and then talk with the parent and encourage the parent to look at different counseling options if that is recommended.
Just to clarify, a student cannot even access the system without the parent signing them up for it. So the parent would have had to have provided permission for the student to be even allowed into the system for them to get access to it.
So there is a referral option. Most schools have referrals where like a student can go down to the counselor's office and say, I heard that my friend was self-harming, so they can still follow that process and refer a friend. But again, the counselor then still has to follow up with the child, and most school policies are that they then connect with the parent if they feel like some additional supports need to be in place. So this does not alter or change what school policies and procedures are. It is simply a tool for them to use to work with that child and work with that family. Yes, ma'am.
I know, I'm sorry.
It's okay.
It was one of those inquisitive kids.
It's
Lorna.
okay.
What about the parent that has a child that they've done everything they can to help this child, and he or she is a problem, and that has some mental illness going on, and so maybe she's lying and telling things to this program that's not true about her parents or his parents,
So the
and they get
program,
pulled into the system legally.
so
Did that
that's not
happen?
how this program works. It is a set of questions that the child can answer that is part of a vetted tool. We looked at the PSQ, the ASQ, the GAD-7, and those were vetted screening tools developed by licensed counselors, and we also included a homicidal ideation question and substance use questions. So those, they cannot journal.
They can lie.
cannot-
That's
They-
what I'm saying.
but
But what
there's-
happens if they make up a big story
They
about mom and dad?
they can answer, like, they can't answer that in that school. They can go to the counselor and state whatever, the Aspen does not control that. A child at any point in most schools can speak with their school counselor. And again, Aspen does not control that. Students can do that in any school, whether they have Aspen or not.
So it's a multiple choice question.
Yeah, these are
That's
multiple choice questions.
screening
Yes.
that tells whether or not the student is high risk of
Yes.
harming themselves. So they're not journaling in, they're not writing names down, they're not telling stories.
Yeah.
None of that is in.
They
this.
can, like, if they are referred or they complete a screening and the counselor talks to them, Aspen cannot control how they respond to the counselor. But it is multiple choice questions for the screening. Does that make sense?
Isn't that what our counselors have been doing all along though, before asking?
So counselors do utilize screening tools. Yes, they always have. That's why we utilize some of the tools that they most commonly use. This is helping to streamline the process. So for example, I just had a call with one of our tools today that just started using the resource directory, hasn't even used the screening tool. And one of the things they mentioned was thank you. This has really helped save me a lot of time. Because now I have an easier way to identify those resources and use them.
In the interest of time, could you go ahead and
Yes,
finish?
I
up?
apologize.
Yes, no, it's perfectly fine. If you have questions, please ask them. Anytime you want, stay this outside of the meeting.
And I will try to get to them. I am working there a lot, so I try to get to them as quickly as possible. So the last thing I have is the funding opportunity request. So we had seen in the leader and online that the Jefferson County Community Mental Health Fund Board had a grant opportunity available for the remainder of 2023. And the Jefferson County Community Mental Health Fund Board was established and authorized by Jefferson County Council and the statute of the state of Missouri to receive and administer a Jefferson County mental illness property tax levy. So I just took that directly from their website, so you guys are aware of what they are. And they do accept requests and proposals in the forms of grants to be utilized for the remainder of the 2023 year. And this request was made public through the leader publication, and additional information can be found on their website. The proposal objectives that I am requesting to write for are to research videographers and production companies to develop quality educational Aspen-related videos pertaining to mental health awareness. Not only how to utilize Aspen, but how to also utilize mental health related resources. And part of it is making the community and parents and individuals and adults also what warning signs might be, you know, how they're feeling, and have some of those educational videos made. We would hire a videographer or production company to develop the education campaign video. And the JCHD Aspen coordinator. I did research some of the costs out there, so that's where in the budget, I did not just pull that out. I did research what some of the cost was to hire entities in either the county or region. Another deliverable would be to develop an Aspen marketing and awareness campaign, which would include virtual and print materials. And then also salary fringe for time of the Jefferson County Health Department Aspen coordinator, the Aspen program specialist, and the Jefferson County program information officer to meet those deliverables, continue resource directory updates, develop marketing materials, research protection companies, monitor video development, and ongoing program planning. So we're seeking funding to develop that campaign to spread awareness, education, not only of the tool itself to make people aware of it, but also, again, I think it would be really helpful to get more information out there for all individuals, youth, adults, and some of our youth groups like first responders and healthcare workers, to get them to understand a little bit more about what's important about mental health in those types of programs. So the total request is $56,300, And that includes, the salaries, fringe, the marketing campaign, and the cost for the video. For that? No, I would be requesting this for permanent. I mean, technically, I guess Brianne's salary would be coming from us, but yeah, this would be, yeah, this would be looking at her time spent on this to make sure that if she was spending on this, it was spent through the grant. Yes, ma'am.
Why don't we, with all these funds, have in-house, we have a nurse practitioner or whatever that sees people on the clinic to help country out, that's bottleneck. I understand that when someone asks for an appointment, it takes them a month to get in to see that counselor. Why can't we help that way with another counselor or two or three, and especially when we have to get our new building, have a wing of counselors that help unbottleneck that process so that people can get in quicker to be.
I don't think that's a bad idea. This funding stream, I don't think would have the funding to be able
I know this
to
one.
cover all of
but-
that, yes, but I don't disagree with that. I think something like that would be incredible for the future. But I think for this particular funding stream, what could really help is what we would have the opportunity to do is this could really help educate. When you think of how many individuals live in Jefferson County, that's over 200,000 people. When you think of the amount of those that utilize different forms of social media, Brianne probably has no data on that, but I've not come prepared with that. But I know that there's a lot of individuals that use Facebook, Instagram, they use YouTube. And I think that this could be an incredible platform to be able to reach those individuals and educate them on mental health. And also let them know what resources are in our community, because if some of our services are bottleneck, there are a lot more services and people are aware of that provide mental health services in our community, that this, having those videos in that campaign would be able to do that. And I also know that not everyone is on social media, and that's why I also included the additional marketing materials, because you know, some people don't use social media, some of our elderly populations, but they may be able to find out more about our resources through things like the leader publications and other print media forms. So that's where we would really look at that to make sure that we hit all of our demographics, not just certain demographics.
As an additional follow-up to that, that is one of the reasons that we contract with our partners and that we partner with multiple behavioral health programs in the county, is because individuals who do mental health and behavioral health have to be supervised by very specific licenses, just like our nurse practitioners are supervised by a medical doctor. That's one of the expenses that we take on. We don't have a medical doctor on staff, but they are through a standing order. They have that supervision. We would actually have to, if we were to bring people onto staff, we would actually have to have a medical doctor over that provides mental health and behavioral health services and pay them to oversee that staff. That's one of the reasons it's more efficient and economical to partner and subcontract with our existing resources who are experts in the area.
Plus, those grant opportunities have to be available.
We need a motion for this.
And I will need a signature, and I apologize. I was so worried about all my other paperwork. I did leave that one on my desk, so.
But it's signature needs to be given.
And I believe it is the board chair.
I'll make a motion that we forward, check and move forward with the grant application and authorize Mr. Deal to sign such.
Second.
Please keep in mind that this presentation was made and the amount was made. Okay. Any other discussion?
Mr. Chairman,
It is in the last page of your packet as well.
Okay, right, thank you. Okay,
Mr. Chairman,
so all in favor?
Mr. Chairman. Mr.
All
Chairman,
in favor, I'm calling vote. All,
you asked if there's, you need to ask a point of order. You asked if there's any discussion.
He did.
Okay, Mr. Chairman,
there was none,
Mr. Chairman,
you're a little late. Quick,
I understand this whole process. even more clearly than before. And I still see this as a glorified way to just get information to people. It's a finite number of vendors. You've got Chestnut, you've got, Country, and you've got, Provident or whatever. For example, that way, that councils and sees people. Then you have, whatever other resources there are. It's a finite number of listings that can simply be put on a website with a link. And all the schools can have it, and they link right to that page, and they get all the information right there. So
They
simple.
truly do not.
And it doesn't have to be all that long, drawn out process, but that's my on record comment. That was my discussion, and
All in favor of approving the grant application, please say aye.
I,
Any opposed?
I'm opposed.
And Mr. Chairman, I have one more comment.
Go ahead.
I have one more comment. to make. I also need to let the board know that I received a phone call today from one of our community partners, that they had received a call from one of our potential funders. The potential funder reported to our partner that a board member from the Jefferson County Health Department called them regarding Aspen and funding concerns. I confirmed with the potential funder that a board member did contact them, and it was clear to them that this board member had fundamental misunderstanding of the program and its funding. I respectfully request that board members please not actively attempt to spread misinformation about the program or sabotage the program. The majority of the board has been supportive of this program, and contacting current funders or potential funder undermines the mission of this program and undermines the efforts of the agency, program, and the board.
Okay, we don't have anything for closed session. Anybody have anything else?
Hi,
Sorry.
I'm still on the agenda. I'm number 3 under the
Second, six.
director support. I'm just gonna go ahead and take podium here. Gonna go ahead and take my seat going.
Got rearranged too many times. I'm sorry.
I know I'm last, and we're moving out of here, but come on, man. I'll do my time. Okay, so okay, if I go?
Yeah.
Perfect. Get on it, man. Okay, so communications update, again, you have my report and your packet. If you need anything additional from that, let me know. As always, lots of times go through any questions that were brought to us, any other things, miscirculations, part of my job. Super look forward to this, so I'm just gonna get going with it. One of the current misunderstandings that's currently circulating, that the health department programs that don't make money aren't successful and should be eliminated. So I want to address that. Though sustainability is a part of program and service planning in public health, the end goal is not to make a profit from the programs and services that we provide. We focus on meeting sustainability costs and breaking even, if you will. The purpose of our programs and services is to meet the needs of the community in the best way possible. Affordable, accessible, quality care. As the needs change in the community, the programs and the services, or the way that we provide them, may change as well. For example, if the community health assessment process determines that mental health issues are a top priority, we may modify or implement new programs, services, and partnerships in order to address that need. Aspen is an example of this. As Jackie stated, several years back, certain community needs, such as a resource referral network and mental health issues, were identified. Partners came together to create the vision for the Aspen platform to address the resource referrals as well as mental health issues. A good portion of our staff are either partially or completely paid from various grant and contract funding sources, which helps alleviate the costs to patients and participants in order to keep our programs operating. To say that a program isn't making money, should be eliminated, defeats the purpose of public health. We do not provide car seats, family planning services, health education, nutrition consultations,
lead screenings, primary care, dental services, and much more, simply to make money. We provide these services because we understand the need for them, and our staff are dedicated to serving our community. Another miscommunication that's circulating in the community is that JCHD staff and or board members are or have accepted kickbacks or pay-to-play money for pushing certain recommendations related to COVID mitigation efforts. Our agency as public health follows the appropriate mitigation efforts for all communicable diseases per CDC and Missouri DHSS guidance and recommendations. No employee at Jefferson County Health Department, nor has any other board member, provided any sort of incentive, monetary or other, to recommend or enact any mitigation efforts related to COVID or any other program. Regardless of what has been stated by others, no employee of JCHD has ever been offered a kickback, let alone accepted something. Perhaps the confusion stems from what is related to funding sources provided public health agencies during COVID. So during COVID, as our presenters kind of alluded to as well, some funding, both federal and state, was provided to assist with implementing COVID mitigation efforts, such as purchasing personal protection equipment, gloves, masks, hand sanitizer, covering the costs for supplies to host vaccination clinics open to the public, infrastructure funds to cover the costs of hiring additional staff like case investigators, contact tracers, etc. Because these funding types were typically contract funds, they came with a set of rules and deliverables about what they could and could not be spent on. This is our guests discussed today. Our agency utilized the provided funding per the regulations set by state and federal agencies noted in our communications with them. There has never been a concern from any of our funding agencies that we are not following contract deliverables. No money was provided to individual employees, administration, or board members as a benefit for accepting said funding or implementing certain recommendations. Another concern that we've been made aware of is that we don't have informed consent for vaccinations, which is not accurate. Per the American Medical Association's Code of Medical Ethics, informed consent is defined as patients have the right to receive information and ask questions about recommended treatments so that they can make well-considered decisions about care. All patients or their guardians, for those under age 18, receiving any type of care or treatment at the health department, sign a consent prior to any procedure or receipt of that procedure or care. A healthcare worker then talks with the patient about the procedure or the service prior to providing it and offers the patient an opportunity to ask any questions. Education on the procedure is provided either in writing or as a resource for each patient. Another piece that I'd like to address is the misinformation that was circulating regarding our Aspen program. Recently, there has been information being shared across social media, inaccurately identifying a Wikipedia page for the Aspen Institute, which is an international nonprofit, with the Aspen tool developed here in Jefferson County. To clarify this, the information posted in that said social media post about the Aspen Institute was a copy and paste from a Wikipedia page about an international nonprofit organization that happens to have a similar name. Again, that information is not related to our Aspen platform in any way. There were concerns regarding that the donations page stated that funds for the Aspen Institute were donated from sources like the Gates Foundation, the Carnegie Corporation, and George Soros. And to again clarify, this is not our program. The international nonprofit organization, the Aspen Institute, was the organization that received donations from those foundations. There are other programs, products, organizations, and places with Aspen in the name, just like there are 27 Jefferson County Health Departments across the country. It is important to be sure that when we are sharing the correct information about the program, it's the information found on the Jefferson County Health Department website or the Jefferson County Health Network website. We were asked to provide information on Aspen grants, including the amount, the date received, and the funder names. So this information can all be found on the Jefferson County Health Department website on the Aspen page under the resources tab. If you go to our website, scroll over to resources, click down and choose Aspen. very bottom of that page, you're gonna click on a button that says Aspen PowerPoint. Within that PowerPoint is listed all of the funders,
Pay attention, please.
the partners.
Stay. Please pay attention.
Are you a schoolmaster now?
Could you please pay attention?
I am
I'm the
paying attention.
chairperson of the
Are you
board,
paying attention?
and I'd like to see people
Are you paying attention?
perform their
Something-
role, perform their role as board members.
Are you looking for it on the website in here?
I'm looking for something.
Are you looking for this page? Because I can help you navigate it.
No, wait.
Okay.
I'm not.
So you're not
Um,
listening to the presentation now. Is that correct?
Because it looks a little different on the mobile, that's why I was asking. It looks a little different than. Within that PowerPoint that's listed on the Aspen page, all the partners, funders, and grant information is listed. That PowerPoint presentation was recently updated as of Monday to include the amount of each grant specifically, clear as day, the very last slide. So if there's any confusions for anyone in the public, please address that. And if you have any questions, email us, communications, or you can email Aspen. We'd be happy to address them. We also received a request to report funds being used for Aspen that are not grants. So currently, salaries, operational costs, etc., are all being covered by grants and contracts. So that's kind of a moot point. What is the estimated amount to be spent per person for services offered through the Aspen program? And again, as Jackie stated before, to clarify, Aspen is a resource tool. So there is no cost per person for direct services because it does not provide the direct services. It simply links individuals to the service providers. And lastly, what is the pay salary of the group or board that is in charge of the Aspen program? The individual's salary at Jefferson County Health Department, who is currently overseeing the program, is funded by Aspen grants to cover all of the work that she does. Those are the questions that we received. Are there any other questions for me?
Who thought of the name of the program? Or where did it come from?
Actually, I did. Aspen, so I shouldn't take all the credit. That's kind of a little pompous. I legitimately was watching a video about community partnerships, and some lady said something about, and she was in a different state. She said something about how her community reminds her of an aspen forest because everyone is connected. And originally I was like, that's super cheesy. But all right, we're gonna look it up. So then I Googled aspen trees. And sure enough, it legitimately is. Like they have a whole underground network of root systems that connects them. And I was like, this is it. So I went, because Jackie and I had been talking about like, what do we need? So we have to have a name. We can't just keep calling it a tool. And she and I kind of spoke and she was like, oh my gosh, this is perfect. And then we were kind of working through what it is, what the purpose of it is, which is the accessing services that provide essential needs. So it really just clicked. I'm not a fate destiny kind of person, but
So at that point, you had the name Aspen, I thought that was cool. Then you took the A and you said, you started thinking of what would go with that for, what each letter stood for.
so technically, yes, yeah, we
You
kind
didn't
of,
find that somewhere else.
no, we created it.
So the A meant accessing and the S services and P provider,
Providing essential
providing
needs.
and E essential and N needs.
Yeah, so like Jackie said, we created the program.
And created that.
She has developed this program from the get-go with our partners. And
And
I just kind
that
of came in on
nowhere
random.
else, anywhere in the United States, that with those letters and those meanings to those letters is nowhere else in the United States.
To my knowledge, no.
Okay.
So there are other programs named Aspen, like we've said before, at the last board meeting, I think there was a full lead Aspen. The piece that I had talked about earlier, that was online, that was a Wikipedia page. There are other programs, products and services that have Aspen in the name. We don't have, rights to the word Aspen. But
I gave you something I printed out,
Correct.
that I looked up and it said Aspen, it was similar to what we're talking about doing, but you said, no, that's not us.
correct,
But I wonder if their letters say the same thing as yours.
they do not. No, their program is Aspen as just the word. They don't have an acronym for it. It's full at Aspen. That's what their product is called. So, yeah, it all came together. Again, it wasn't anything that was in a vicious attempt or anything crazy. It really just clicked. That's the purpose of the tool, is to connect individuals. And it made the most sense and it fits what we're doing. So
It's called the pilot program. It's got the same same letters and they say the same thing with you.
Right, so it doesn't say the same thing, we established that last time, that's a student information system, it's a different program, but I will say, kind of to what I said before. There are other programs that have Aspen, I mean, I can't say that there aren't, just like. There's a Jefferson County Health Department in Alabama, there's one in Colorado, there's one in California, I get emails quite a bit from people that think our webpage is theirs, which makes me feel happy, because that means ours is tagging pretty high, but, it's so, to say that there's nothing else in the world that has Aspen isn't simply true.
I mean, this program is well developed, it talks about, software programs.
I'm sure it has.
It's, you know, just so similar to what you guys are talking about doing. It's,
Let's
you
move
know,
on. Are
I
you
mean,
ready?
you're saying that you all thought of it, right, and you named it. But
There's
there's
not
a
really
regular
the rock
named
indicators
it
now.
elsewhere. Just saying.
I mean, there's also Phoenix and facial tissues, it's the same concept, and the things are allowed to have the same names.
Did it bring it?
That's all I had, unless y'all have any other questions.
No, thank you.
Appreciate it.
Thank you very much.
Thank you.
We have nothing for.
I don't have any proposed, just want to let the board know before you all adjourn, know that you will be, you actually probably have it right now in the inbox, a link to conduct the director's evaluation. It's being done just like it was last year via a Microsoft form. That the results get compiled. We have to do it now because by the contract, the evaluation results have to be delivered by May 1, so in order to tabulate those in time for the April board meeting and present the results to the director and for the board to decide what to do with those, it needs to be conducted at this time. So you could have a link in your email that allows you to complete that evaluation.
Is there a deadline for that? Chris?
I think it was the 7th. Right,
You did in the.
it's in the email.
It's something we'll do at the April board meeting.
No, you do the evaluation now. And the results are compiled in order to present those results at the April board meeting and to give those results to the director so that you can improve on performance or.
A lot of things could change possibly after the election, so.
Miss Davis, by contract, this is the way the timeline has to go. So, thank you.
We have a motion to adjourn. Motion to adjourn.
Right.
All in favor? Aye.